Hi, this is Shannon Netson. I'm a student with Indiana State University. I'm taking a course in community health and I am doing a presentation over diabetes awareness. Our learning objectives for this presentation is what is diabetes? We'll take a pretest. What are the symptoms of diabetes? What are the different types of diabetes? How is diabetes treated? How can we prevent diabetes? We'll take a post-test and we'll review the resources that were used to help make this presentation. First, what is diabetes? Diabetes is a chronic illness that affects how your body turns food into energy. Most of the food you eat is broken down into sugar or glucose and released into your bloodstream. When your blood sugar goes up, it signals your pancreas to release insulin. Insulin acts like a key to let the blood sugar into your body's cells to use as energy. If you have diabetes, your body either doesn't make enough insulin or can't use the insulin it makes as well as it should. When there isn't enough insulin or cells stop responding to insulin, too much blood sugar stays in your bloodstream. Over time, this can cause serious health problems, such as heart disease, vision loss, and kidney disease. We'll take a pretest, so pause the video, the link below that looks just like this. Click on that. You'll take your pretest. When you're done, come back to the video and we'll continue on with the presentation. Okay, thank you for taking the pretest. We'll move on to what are the symptoms of diabetes. There are several symptoms. The ones that we're going to go over are increased urination, so you'll pee a lot, often at night. You'll have an increased thirst, so you want to drink a lot of water. Weight loss without trying. Your vision can get blurry. You have you're extra hungry, so increased hunger. Numbness or tingling in the hands and feet. Fatigue, which means feeling very tired. Your skin gets dry. Sores that won't heal as quickly as they used to. You have an increase of infections, and your breath can smell fruity. The types of diabetes are type 1, type 2, and gestational diabetes. First, we'll review type 1. The cause of type 1 diabetes is unknown. It is an autoimmune disorder where your body's immune system cannot distinguish its own cells from invading cells, so it attacks itself. This action causes the pancreas to stop making insulin. This is mainly diagnosed in children, teens, and young adults, but can occur at any age. Type 2 diabetes. The body makes insulin, but cannot use it well. The body is not able to maintain a normal blood sugar level. 90 to 95% of people in the U.S. have type 2 diabetes when we're looking over all of the types of diabetes. This develops over many years. It's mainly seen in adults, but with increased incidence of obesity in children and teens, it is seen more often in this age group now. And then gestational diabetes. This develops in pregnant women that have never had diabetes. Weight changes during pregnancy causes the body's cells to use insulin less efficiently, puts the baby at a higher risk, and babies that are born to mothers that have gestational diabetes are weighing up to 9 pounds or over. Premature birth that causes breathing problems in the infant, low blood sugar levels, and causes them to be at an increased risk of developing type 2 diabetes later in their life. The blood sugars in the mother usually return to normal after delivery, but the mother is at risk for developing type 2 diabetes later in her life. So what are the treatments for diabetes? The three types of diabetes are treated very differently. Type 1 diabetes, they have to monitor their blood sugars regularly. They have to use insulin, and this insulin is given either by a pump that they wear, injections by syringe, or the new pen injectors. The types of insulin are long-acting that lasts 24 hours. Fast-acting insulins they use just before eating a meal to help keep their blood sugars lower after eating. There's two things that can happen with type 1 diabetes. You can get hypoglycemic if you over-treat your blood sugar with insulin. So this is a low blood sugar. Usually in treating this, you have 15 grams of a fast-acting carb, which is equal to 4 of the glucose tablets, or you could have a half a cup of orange juice or something quick to bring that blood sugar up. Hyperglycemia, which is high blood sugar. Usually this is treated by a sliding scale of fast-acting insulin provided by your healthcare provider. Type 1 diabetics need to maintain exercise and a healthy diet daily. Type 2 diabetes, diet is number one. They want to eat lean meats, vegetables, fruits, low carbohydrate meals. Oral medications are required, and at times insulin will be used if the oral medications cannot keep their blood sugars under control. They want to monitor blood sugars and keep a daily record of those. Exercise at least 30 minutes every day, and get rid of the sugary drinks. Always remember, don't drink your calories. And gestational diabetes is pretty similar to type 2. You want to eat healthy foods, get plenty of exercise, monitor your blood sugar, take medications as prescribed, and your OBGYN will monitor your baby's growth and development. So how is it prevented? Well, there are no prevention strategies available for type 1 diabetes since this is an autoimmune disease and we don't quite know why it happens. So we can't really prevent that one. Type 2 diabetes, weight control. You want to maintain a BMI less than 30. Balanced, healthy diet, fresh vegetables, fruit, and lean meats. If you're eating carbs, make sure they're healthy carbs. Exercise 30 minutes every day where you're getting your heart rate increased. Gestational diabetes prevention, weight loss before pregnancy, physical daily activity, and discuss healthy weight gain during pregnancy with your physician. Okay, we'll take the post-test. You can pause the video. When you're done with the post-test, you can come back and we'll look at the resources that were used during this presentation and for further education for yourself. Thank you for taking the post-test. The resources that were used for this presentation is the cdc.gov diabetes, the American Diabetes Association, and the World Health Organization over health topics over diabetes. All of these three sources have very good information about diabetes if you want any further information. Thank you for watching my presentation.